Come
Hello.
in.
Hey. My name is Keith. I'm gonna be your student nurse today. Can I get your name and date of birth, please?
Carly Norris, 2399.
Okay, Miss Norris. I'm gonna perform hand hygiene. You're gonna tell me what to do. Okay, Miss Norris. I'm gonna be doing a quick head to toe assessment. It's gonna take about 15 to 20 minutes. Okay. I'm gonna be asking you questions. I'm gonna be touching you. Is that okay?
Yes.
All right, Miss Norris. Can you tell me where you are right now?
Elsie.
Okay. Can you tell me your last meal you had?
I had Chick-fil-A for lunch.
Okay, so patient is oriented to person, place, or time. Uh, her general mood or affect is calm and happy. She's hygienic. Her hair is well kept. Her nails are clean. Her posture is upright, and her general skin color is pale with pink undertones. All right, Ms. Norris, I'm gonna inspect your skull. So I see the skull is normal cephalic. It's round, and there's no lesions. Then I check the hair. I see that the hair is thick, dark brown, straight, and it's evenly distributed. Okay, from the hair, I check for tenderness. So tell me, do you feel any tenderness when I do this?
No.
All right, so patient has no tenderness. Okay, so from there, I actually check facial symmetry. Okay, so I see that the face is symmetrical. There's no lesions, and there's no drooping or ptosis. And from there, I'm going to actually do facial movements. So can you wrinkle your forehead? Can you puff out your cheeks? Can you smile? Can you close your eyes? So cranial nerve 7 is intact. Then open your eyes. Okay, cranial nerve 3 is intact. Can you stick out your forehead? Okay, stick out your tongue. So cranial nerves 12 is intact. So now I'm going to actually palpate your sinuses. Do you feel any tenderness?
No.
Okay, and then I'm gonna check your temporal pulse while I'm still palpating up here. That's 2+ bilaterally. Okay, so now I'm gonna check your eyebrows. So I see that the eyebrows, they're distributed outward. They're black, they're thick, and then I check the eyelashes, and they curl slightly outward, and they're also thick and black as well. Okay, so now I check the eyelids. So the eyelids are symmetrical bilaterally. Can you blink for me? Cranial nerves 3 and 7 are intact, and there is no drooping or ptosis. And then from the eyelids, I actually, can you pull your eyelids down here? To the conjunctiva, it's pink, moist, and there's no discharge. Can you bring them up for me? Okay, sclera is clear and white as she looks around, and there's no clear white, not cloudy. And then from there, I'm gonna do a few tests. So I want you, first I'm gonna do 6 cardinal fields. So can you look at my finger? We'll go straight across, don't move your head. Okay, so parallel tracking for cranial nerves 3, 4, and 6, and there's no nystagmus. So now I actually do check your pupils. So I see your pupils right now at about 3 millimeters, and I look at my nose, look at my finger please, don't move, okay, and the pupils constrict to about a 2. So I want you to look at my finger real up close, and that 3 constricts to about a 2, and look at distance, and they dilate to about a 4 millimeters. So pupils are equal, round, and react to light and accommodation, and they constrict in close, and they dilate in distance. Okay, so from there, now I'm gonna check your ears. So I see your ears are equal bilaterally. The color is pale, it's C-shaped, and then I check for drainage. I see no drainage on the ear canal, and then from there, I'm actually gonna palpate your ears. Do you feel any tenderness there?
No.
So no tenderness and no nodules, and I go back here to the mastoid process. Do you feel any tenderness?
No.
All right, no tenderness and no nodules. Okay, so from the ear, I ask you, I'm actually gonna do a whisper test. So I want you to cover one ear, and I'm gonna whisper a series of things. Repeat them back to me. Red, blue, yellow.
Red, blue, yellow.
Red, blue, yellow.
Red, blue, yellow.
Okay, cranial nerves 8 are intact, and she was able to repeat 100% of the words. So Miss Norris, have you had nasal surgery before?
No.
Have you had nasal trauma before?
No.
Have you had, do you have difficulty breathing?
No.
Okay, so now I'm gonna inspect the nose. So I see the nose is symmetrical at midline. It's very straight, and there's no discharge. Okay, so from the nose, I'm gonna ask you to do a series of tests. I want you to cover one nose, take a deep breath in and out. Then do the other nose, take a deep breath in and out. Okay, so a patient on occlusion of one nose, could we
I could breathe the same.
Okay, so patient was able to breathe the same. So patient was able to breathe effortlessly and same through both nostrils, and there was no patency on either side. Okay, so from there, from the nose, I move down to the lips. I see the lips are symmetrical, pink, moist, and there's distinct vermilion border. And can you open your mouth for me, please? Okay, so I see the general color is a pink pale color. The heart palate is smooth and it's immovable. It has transverse rugae. And now I'm gonna get my tongue depressor. I pull your tongue down. Can you say ah for me? Okay, so there's a soft rise in the soft palate. So cranial nerves 9 and 10 are intact. And I saw the uvula was midline. Her tonsil was a 2+, and there's no exudate. Okay, so from there, now I'm gonna move down to the the neck. Okay, so first I'm gonna do is check a carotid pulse. Okay, 2+ there, and 2+ there. Okay, so the carotid arteries were a 2+, and the amplitude was smooth and rhythmic, and the trachea is midline. And I want you to shrug your shoulders for me. Okay, 5 out of 5 bilaterally for the trapezius muscles, and from there I'm going to actually check lymph nodes. So I go parotid, preauricular, postauricular, sternomastoid, occipital, posterior superficial cervical chain, supraclavicular, anterior superficial cervical, submandible, sublingual, submental, and tonsillar. So, did you feel any tenderness while I was doing that?
No.
The patient reported no tenderness, and there was no enlargement of lymph nodes. And then before I move on to the posterior, I want you to actually smell this. Close your eyes for me. All right, tell me when you smell something.
I smell it.
Okay, cranial nerve 1 was intact. Okay, so now I'm gonna go to the posterior chest. Okay, so shoulders are bilaterally symmetrical. The posterior chest muscles are well developed, and there's the symmetry of the scapular placement is bilaterally symmetrical. And so from there, I'm actually gonna put my thumbs around T9 and ask you to take a deep breath in and out. Okay, so my thumbs moved out and back in evenly, so that shows thoracic expansion was bilaterally symmetrical. So can you put your arm behind your back for me, please? So now I'm gonna go for lung points. So I start at the top of your scapula, which is 1, and go to the other side, 2. Then I go down 1, so then it's 3, which is 2. I go 2 finger lengths down, which is 3, then 4, then mid scapular, 5 and 6, and then I go bottom of the scapular, 7 and 8, and I go to the 10th intercostal space, which is 9 and 10. Okay, then I move on to the vertebral alignment. So the first thing I do, I'm gonna ask you to touch your toes. I'm gonna go from C7 down to T12. Tell me if you feel any tenderness.
No.
So patient reports no tenderness, and the vertebral alignment is straight, and the posture is erect and upright. So now I'm going to check the anterior portion. So I see the anterior muscles are symmetrical, they're well developed, there's no pulsations. And now I ask, do you have a cough?
No.
Okay, so the patient reports not having a cough, but if she did, I would ask if it's productive, and I'll note the amount, color, consistency, and if it had an odor. Okay, so from there, I'm gonna actually do heart points. So I start at the suprasternal notch, I go down to the angle of Louis, and I go down to the right sternal border at the second right intercostal space, and this is the aortic valve. And I go to the other side, to the second left intercostal space, left sternal border, which is the pulmonic valve. I go down to the third intercostal space in the left sternal border, that's Erb's point. And I go one more down to the fourth intercostal space at the left sternal border, and that is the tricuspid valve. And I go down to the fifth intercostal space at the left midclavicular line, and that's the mitral valve. Okay, Ms. Norris? Okay, so now what I do is check upper extremities. So you rub your sleeves for me. Okay, so I see sparse hair distribution, and I see no lesions. Okay, so I'm gonna now palpate. You feel any tenderness?
Nope.
Patient reports no tenderness. Her skin is warm, temperature is warm. I pinch, the turgor is elastic, and now I'm gonna check your fingernails, the nails. So I see the nails, they're rounded. It's at a 160-degree angle. The color is pink, and the nails are cleanliness and they're well kept. Okay, so now I'm gonna check your capillary refill. I'm gonna pinch. It's less than 1 second. Then I check radial pulses. Okay, it's a 2+ bilaterally. And now what I'm gonna do now is, can you do the opposition for me? Okay, do that. Touch each finger with your thumb. So that's cerebellar function intact. And now I'm gonna check upper extremity. I want you to push towards yourself. Push towards yourself, I'll push towards me. Okay, bicep muscles are 5 out of 5 bilaterally. I'm gonna push towards you, you push towards me. Tricep muscles are 5 out of 5 bilaterally. And then can you lift your arms up? Okay, deltoid muscles are 5 out of 5 bilaterally. So now I would check your abdomen. I'm not gonna make you lay down for this video purposes, but I would ask you to lay down. And first I'll go eye level and I'll check the color of your skin. I see the general skin color is pale with the rest of your body. I see, I'll see for lesions, and I wouldn't see any. I'll check the contour, and I'll see it was flat. And then from contour, I would see, I'll check from the top, and I'll see the umbilicus is midline, and there's no abdominal pulsations. And then from there, from inspecting, what I'll do is auscultate. So I'll start at the right lower quadrant, and then go to the right upper quadrant, then left upper quadrant, then left lower quadrant. And you're supposed to hear normal active bowel sounds, and I'll listen for about 5 to 10 seconds, but then if there was no sounds, I'll listen for 3 to 5 minutes. Okay, then I'll palpate. So I would ask you, can you tell me if you feel any tenderness? So I'll start right lower quadrant, and I work my way up in a spiral formation all the way to the umbilicus without raising my fingers from the umbilicus.
No tenderness.
Okay, and the patient report no tenderness, and then so patient report no tenderness, there's no masses, no rebound tenderness, no guarding. Okay, so for abdominal, ask, when's the last time you voided?
Today.
Or how many times do you void, I'm sorry?
6 times a day.
So the patient reports voiding 6 times a day. Can you tell me the amount?
A little.
Can you tell me the color?
Yellow.
Can you tell me if it was clear or cloudy?
Clear.
Can you tell me, did you feel any pain while you voiding?
No.
So patient report no voiding. So when was your last bowel movement?
Today.
Okay, can you tell me the color?
Brown.
Can you tell me the amount?
A little.
Can you tell me the consistency?
Soft.
And now I'm going to move on to lower extremities. Okay, so I inspect the lower extremities, and I see that our skin is pale, it's symmetrical, sparse hair distribution, and no edema. So I'm going to palpate. Do you feel any tenderness?
No.
The patient reports no tenderness. The temperature is warm, and and there was no lesions or deformities. So now what I'm going to do is, and then now I'm going to palpate. Now I'm going to check. Now I'm going to find the dorsal-pedis pulse. So it's in between the great toe and the second toe, and it is a 1+ bilaterally. And then I check the posterior tibial, and this is posterior to the medial malleosus, and it's 1+ as well bilaterally. Okay, so now I'm going to check your lower leg extremity muscles. Okay, so I'm gonna put my hands on your upper thigh. Can you push up for me? Okay, that's 5 out of 5 bilaterally. I'm gonna go outside of your thigh, 5 out of 5 bilaterally. Okay, now go inside your thigh. I want you to push in, 5 out of 5 bilaterally. And I want you to kick out towards me, 5 out of 5 bilaterally. Now I want you to push in towards yourself, 5 out of 5 bilaterally. So upper and lower leg extremities were 5 out of 5 bilaterally. Now I'm gonna check the plantar and dorsiflex. So I want you to dorsiflex your feet for me, please. Kick your feet up for me. So dorsiflex was 5 out of 5 bilaterally. Now I want you to put your feet down while I push up, 5 out of 5 bilaterally. Okay? So I want you to grab my finger real quick and squeeze. Finger strength was 5 out of 5 bilaterally. Okay, so Miss Norris, can you sit up for me, please? So patient was able to sit up, no problem, no struggling doing that. No use of accessory muscles, and also quick note that the patient is a chest breather and had no trouble breathing in, and it did not use accessory muscles for that as well. So Miss Norris, do you use any accessory devices, assistive devices to walk?
No.
Okay, so if there was, I'd help get that for the patient. So can you stand up and walk there and back for me? All right, so patient gait is smooth, steady, symmetrical with no hard swing. All right, patient sits back. So I would help the patient sit back down, but she's able to do that by herself. Okay, so Ms. Norris, I'm gonna put the bed in the lowest position. I'm gonna get your call bell. I'm gonna lock the wheels, and I'm gonna put one side rail up. Okay, thank you for doing this head to toe assessment with me. Do you need anything else, Ms. Norris?
No.
All right, and that's done. Thank you.
Thank you.